What are neuromodulation devices? Neuromodulation devices are a class of therapies that enhance or suppress the activity of the nervous system. Since migraine may be related to hypersensitive nerves, these devices can be an innovative alternative to medication for those seeking relief from migraine attacks or cluster headaches. When it comes to treating migraine, some of these FDA-cleared non-invasive devices may terminate attacks that are already underway, and others may prevent attacks from happening in the future. There are various types of devices that stimulate different nerves within the body and use different methods to treat migraine. Let's take a look at some of those devices and methods. GammaCore uses non-invasive vagus nerve stimulation to block pain signals that cause migraine attacks. Neurovio utilizes remote electrical neuromodulation to stimulate fibers in the upper arm, activating pain inhibitory pathways. Hedaterm Encephaly apply trigeminal nerve stimulation to reduce headache frequency and intensity by modulating pain pathways in the brain. Savvy Dual utilizes single-pulse transcranial magnetic stimulation to signal the brain to quiet the hyperactive nerves thought to be the source of migraine. So how do you know if you are a good candidate for a neuromodulation device? Neuromodulation devices are typically considered for patients with poor response to medications, elevated risk of medication overuse headache, or individuals seeking non-pharmaceutical options. Patients with chronic migraine attacks that necessitate constant management may also be a good fit, as well as adolescents and pregnant individuals or those planning pregnancy. Side effects are generally limited and rare, and the devices may be used alone or with medication. Not all of the devices require a prescription, but it's still essential to consult a healthcare provider before using a device to make sure it's suitable to your treatment plan, especially if you have a history of seizures or possess other implantable devices like pacemakers or prosthetic limbs. Neuromodulation devices hold great promise, and approaching them with a balanced perspective will help ensure the best outcomes. When matched with the right candidates, these devices can provide a promising path to relief and a better quality of life.